Thank you for the introduction. Mark and I are pleased to be here today to share information about a pan-Canadian initiative on ODT and how it's relevant to this community and others in the ODT community. We'd like to share with you the vision and benefits of the project, as well as activities updating in terms of the system performance indicators and data standards, the repository, and point-of-care digital investments, specifically focus on deceased donation, and how to stay connected with the project, of which a number of you have already been with us along this journey. We're in year 3 of a 5-year project that's a significant federal investment of just over $40 million into ODT digital infrastructure, standards, and reporting. Mark will tell you more about Infoway-led digital investments into point-of-care solutions, specifically starting with deceased donation to support your clinical workflow and more efficient data capture. And on the CIHI side, we're leading data collection and the development of reporting tools based on pan-Canadian standards that will help drive system performance improvements and ultimately better patient outcomes. And this database, once developed, can be leveraged by CCCF members, as well as others, for linkage to larger data sets and for your quality and research initiatives. When I think of the vision for this project, and it's a vision that this community has contributed to and dreamed, and CIHI and Canada Health Infoway are pleased to co-execute with yourself as collaborators and partners. I think of a recent milestone in which a pair of deceased donor lungs were transported by drone 1.5 kilometers in downtown Toronto. And it was received and successfully transplanted in the recipient, who 2 days later was able to participate in his youngest daughter's wedding. So when I think of this project, what we endeavor to do, and invite you to share and continue to help support us in this, is to tie together information about that deceased donor, clinical characteristics, donated organ characteristics as well, tied to the transplant recipient information, system information, and others, so that we can not only track the transplant outcome in the short term, but also long term. And to do so in a way that the information is captured digitally in a way that supports clinical workflow and is seamlessly made available for comparative reporting, so that what we can achieve is a high-performing ODT system. Our project has activities across 5 work streams. The teal represent those that are CIHI-led, and red identifies the Infoway-led activities, although both organizations work very collaboratively across all aspects of this project. In terms of indicators, we're performing activities that aim to identify what's most important to measure for the system. These indicators would be collected using data according to pan-Canadian data standards, and that's needed so that we could have data that's comparable across the country and reported in that way. The data would be stored in a pan-Canadian repository held at CIHI, and in a way that makes it linkable to other national data sources. And the reporting tools that would be available would include private and public mechanisms, as well as third-party access and access for those who provided the data, so that they could continue to monitor and drive improvements in the system. And Infoway's activities, which Mark will tell you about, revolve around investing in deploying digital solutions that support the work of the system operators, specifically ODOs and transplant centers, again, so it can support efficient workflow and have the data flow digitally and seamlessly through the system. This project is fully funded by Health Canada, so we report directly to that organization. As well, it's sponsored by Health Canada's ODT Collaborative, specifically the Data System Working Group that is co-chaired by Dr. Matt Weiss, as well as Dr. Joseph Kim. This group ultimately reports to the Conference of Deputy Ministers of Health. And back in June, this project was presented and received full endorsement in terms of the activities planned and underway over the next couple of years. On the right side, we have the various project advisory groups. This project could not be undertaken without significant collaboration. And many of you here today have already provided expertise and time. We're very grateful for that. We host a provincial territorial advisory group comprised of Ministry of Health representatives, as well as we convene experts according to certain topics such as indicators and measures, data content standards, as well as the digital solutions, where we have both business and technical inputs. In terms of our process for developing the ODT performance indicators and measures, we're currently at the prioritization stage, with the goal of identifying what's important to measure. And this fall, over the next few months and over the winter time, we're hosting a series of expert advisory forums to identify just that across deceased donation, living donation, and transplantation. We've completed environmental scan, a shortlist review, and after prioritization, there's further development of the prioritized indicators for feasibility and other methodology, and ultimately for reporting. On our CIHI website, we have an ODT project page, and we have published the short list of indicators and measures for prioritization. Back in June, we released a survey of these indicators to over 350 stakeholders in the ODT community, and this spans clinicians, researchers, government, system operators, as well as patients, donors, and their families. And from the results of that survey, we're now hosting the expert advisory groups specific to the topics. And very recently, we just held 2 focus sessions on deceased donation. And some of you may have participated in this session. Out of the 24 indicators that were identified in the original shortlist, 13 have come out of that process in terms of being prioritized for CIHI performance reporting. Listed a few of them here: organ yield, missed referral rate, consent rate, and family overturn rate. As a next step, we'll be fleshing these out in methodology and feasibility discussions for further prioritization for reporting. So one of the examples of these indicators is organ yield. And this is one that we hope to report at an aggregate level by facility or by ODO. But in order to do that, we need to break it down into the specific data elements that need to be collected. And so in this case, it would be the transplant status of each of the different organs. So a yes or no flag, whether the left or right kidney was transplanted, heart, pancreas, liver, and others. In addition, in order to report on this properly, we also need to collect the death determination status, whether DCD or NDD, for instance, so that we could report according to those categories. And as well, we collect information on donor age and donor comorbidities, as these may affect the organ yield. So these would be the data elements that would comprise the minimum data set. And available on the CIHI website, the ODT project, is the deceased donation minimum data set, which has already been published. And thanks to a lot of collaboration with people at this table, as well as others, including those working on the Missed Donor Opportunities Project, Canadian Organ Replacement Register, provincial initiatives, and other clinical and business experts. We've also incorporated a CIHI lens in terms of pan-Canadian standards to ensure that this data is comparable and can be linked to other national data sources, such as those held at CIHI. Mark will tell you in a few minutes about the Infoway-led RFP for deceased donation. And in this case, this minimum data set has been embedded as part of the vendor requirements. And therefore, that will ensure that active purchasers under this RFP would have this data set part of their workflow already. And we're endeavoring to have a seamless collection, digital collection of this data, and a seamless transfer of this data to CIHI for performance reporting. These are the different reporting and data access streams that we envision for this ODT data. On the CIHI website, we would endeavor to have some indicators, high-level indicators, that would provide a big picture view. And this data would be accessible by anybody in the public, including donors and donor families and others. We would have more granular detail and much more complex measures in a more private reporting environment. And this would enable comparisons across provinces, across hospitals, ODOs, for instance, for the purpose of quality improvement and driving system performance. And these would be updated on an annual or quarterly or a regular basis. If you go to our CIHI website, you will see Your Health System, which is a reporting tool that we have that already has this type of reporting environments. And then the data would be accessible, as it is with other CIHI data, to third-party researchers, clinicians, and others. And it would be linkable to other data sets. And we'd also make it available for those who provided the data to us, where they can get their own data set or receive some data in terms of aggregate information for comparison to others. And now I'll turn it over to Mark.
Thank you, Nicole, and hello, everybody. I thought for our The first slide in my portion of today's presentation, I'd begin with a future state overview of the ODT data and reporting system. Sometimes a visual is helpful to contextualize what it is that we're striving to achieve over a several year project. What you'll first note on this slide is that there's two dominant colors of blue and green. I'm going to describe some of the software capabilities that are within scope of our project, including areas where solution integrations are targeted. The blue section really features two of the domains where investment will be deployed to support the implementation of point-of-care solutions, both in ODOs as well as transplant centers. The green section features the infrastructure that will be cited at CIHI, including an ODT data repository with report writing capability. As Nicole's already shared, CIHI will operate this service on behalf of jurisdictions and the ODT community. You'll also note dashed lines, and you know that Nicole has already referenced solution integration. The dashed lines really represent solution interfaces that are within scope for the project's approved plan. For example, in the blue section, you'll note integrations that are planned between point-of-care solutions to CIHI's infrastructure. An example of this is where we see deceased donation management solution integrations to that endpoint, but also integrations to other targeted endpoints, including local allocation systems and CBS's CTR. The final comment I'll offer on this slide is that there is a real need and much more potential for continued investment in the ODT sector in Canada. We believe it's in our collective interest to continue to build on the foundation that this 5-year project and its associated funding has made possible. But we don't believe the work will be concluded within 5 years, and we hope that you agree. So what are some of those key aspects that we're targeting for investment, particularly investment into solutions? Well, for organ donation organizations, some of you will be already using commercial software to help manage the deceased donor journey, but many of you are still relying on, well, what we call old tech. That's paper, those are phone calls, those are faxes and emails. And what we're really trying to move toward is a digitally enabled operational system, as Nicole has already referenced several times, capturing data digitally and integrating those solutions that contain those data such that we can take a minimum data set from them and use that minimum data set to support the pan-Canadian ODT reporting, performance reporting. So we have 3 jurisdictions presently using a commercial solution to manage donor cases, and we would like to bring the other 7 jurisdictions up to that same level of standard. So our number one priority is to bring everybody to a level playing field and to see that all organ donation organizations are in fact using a commercially available solution to help manage those deceased donor cases. With respect to transplant and living donor programs, we estimate that our present funding will enable up to 7 hospitals to acquire and deploy and integrate clinical information solutions that will serve to transition them from paper documentation to digital health records. I think Nicole's already pointed out that an overarching goal is that we support workflows. We try to create increased efficiencies in clinical workflows, while at the same time embedding Canadian data standards into the point-of-care solutions, such that we have the potential to use high quality and timely data to support comparable performance reporting. That output will, of course, support continuous quality improvement and innovation and research. I think many of you will be familiar with the deceased donation management capability. Many of you have been very supportive of the project and have been engaged in expert advisory forums. But it's probably worth reminding folks what the value proposition is of a deceased donation management solution. We see it as delivering value through standardized workflow, standardized documentation, improved communication, and really reducing the time it takes to work cases, to make offers, and to really bring that process to a close. Operational dashboards are oftentimes part of commercial solutions, and these operational dashboards provide a line of sight into real-time management of cases. These solutions often have analytical reporting capabilities, which enables organ donations to look at their referral networks and to assess performance and really to target areas for improvement. And of course, these solutions have the ability to support record audits. So if we think of the objective of reducing missed donations to 0, what we are seeing is that deceased donation management solutions really enable those record audits and help speed up what is oftentimes an onerous and manual process presently. At a jurisdiction level, through solution integration, these data that are part of recording the deceased donor journey can be transmitted to third parties. For example, we can list a patient with CBS's Now registry, or we can send a standardized data set to CIHI's ODT data repository to support their reporting mandate, but also support other secondary uses of those same data, as we'll be capturing patient-level records. I think, as you've also heard from Nicole, is that we are currently, at the time of this recording, presently midway through the evaluation of vendors who have responded to an RFP for a deceased donation management solution. We're delighted to say that more than 25 evaluators from across Canada are joining us and working through a rated requirements process that has just ended. And we hope to be in a position prior to the holiday break in December to announce the winning bidder. The second major domain that we're addressing is, as you know from our earlier slides, is the transplant and living domain. Our project has allocated funding almost equally between organ donation and transplant. And again, we are hoping to assist organizations in a number of ways. In the first instance, where those who are still documenting patient care on paper, we believe that there's potential to help them acquire a clinical information solution to help them with that documentation of patient records. With that in place, we of course will target solution integration between the transplant program and CIHI, such that we can ingest a transplant and living donor minimum data set into the CIHI ODT repository to support the Pan-Canadian performance reporting. Many of our hospitals that provide transplantation have already acquired or are presently acquiring a clinical information solution. This is terrific news in the sense that we will leverage what's in place already and work with it. And the target for investment in this case would be to support solution integration, again, from the software that's being used by the transplant program to the CIHI ODT repository. And lastly, for those organizations that may not be able to take advantage or where we possibly will run out of money, that's a real possibility. We don't want anybody to not be able to participate in this initiative, and we'll be creating capability for hospitals to enter their data directly to the ODT repository at CIHI through web tools. So we've been recently spending maybe a couple of months revisiting all of the transplant centers that we had previously been in touch with. Certainly the first part of this project, the first couple of years, was focused on organ donation organizations. So we're reintroducing the project and ourselves to transplant centers. And we've completed 16 of these virtual discovery meetings in the last couple of months, meeting with transplant teams, surgeons, clinicians that support patients prior, during, and after their procedures, as well as folks that are involved in administration and IT. And they've been really productive, and they've clearly illuminated some of the challenges that exist for these teams. We've, as I said, met with 16 of them already, ranging from programs that do as few as 17 transplants a year to programs that do well over 700 transplantations a year across different solid organ groups. And some of the information on the slide really presents to the current state and the challenges that we find in the current state. There are more than 20 different ways in which these transplant programs are documenting patient care, including the use of paper records. Many of these sites have expressed a desire to move from their current state to acquire new software capability to help them document patient care. And ultimately, what we're seeing is some commonalities across these 16 different programs that we've met with just recently, including a commonality around the administrative burden in data entry, the lack of software capability, or where it exists, the lack of integration to that software, and frankly, the lack of capital resources to acquire digital transformation. So for all of us, I think this is a real opportunity and a great one that has been supported through Health Canada funding. And we look forward to helping transplant centers in a similar way that we will help organ donation organizations. So what's next in this project, and how to stay connected to us if you haven't been part of some of the proceedings already? Well, as Nicole's already said, we're well into the third year of this project. We have multiple work streams organized into kind of 5 areas that has been reviewed already. But the highlights in the third year of our 5-year project is that we are working together with you. That's both CIHI and Infoway, and each of those two organizations, as Nicole has already shared, is leading in areas of where they have their competencies. Red representing Infoway-led areas, and green representing the CIHI-led areas. From the perspective of Infoway, we are pivoting, I guess, from planning, particularly in the DDM domain area, sorry, the ODO domain area. We're pivoting from planning, which included a procurement exercise, to solution deployment and integration. We believe that the very first provinces will start to deploy solutions perhaps as early as the end of this fiscal year, but most certainly we would look for the very first organizations to start to deploy in Q1 of next fiscal year. So how can you support the ODT data reporting project? Well, if you haven't been part of the process already, there is always room at our table. We would encourage you to connect with us when you're planning any deployments of solutions. If you are involved in a project that relates to ODT data and reporting, we would like to be able to leverage your experience and ensure that we're not redundant with our respective activities. As Nicole has already shared with you, there's several working groups. They are ongoing, and there is plenty of opportunity to join those groups and to be part of the collective that's starting to inform this project, whether it's on the technology side or on the data side. And lastly, we just encourage everybody to continue to advocate for timely, high-quality ODT data capture and its reporting, such that we can continue to drive improvements in Canada's performance at its system level. And if you'd like to get in touch with us, if you'd like to access some of the already published work, please connect to either Nicole or myself. We can be reached through the contact emails that are listed there, and both organizations are maintaining web pages as it relates to this project. Thank you very much for your attention, and Nicole and I will welcome your questions.